Ladies and gentlemen, welcome to our podcast series on healthcare and well-being at MedSynapse. I'm your host, Dr. Nigar, and today we have a very special guest joining us, Dr. AmirYousef Zahedi. Dr. Zahedi is a highly accomplished physician with extensive experience in family medicine and medication safety. Dr. Zahedi obtained his MD degree from Tbilisi State Medical University, and he's currently practicing as a family physician in Norway. He holds a medical license in Norway and has been actively involved in providing comprehensive healthcare to his patients. In addition to his clinical practice, Dr. Zahedi is also an expert in pharmacovigilance and drug safety. He works with Primivigilance, a prominent company based in the United Kingdom, where he specializes in ensuring the safety and effectiveness of medications. Dr. Zahedi's expertise extends beyond his clinical and pharmacovigilance roles. He has published several articles on topics such as COVID-19 anxiety, self-care behaviors, and psychological well-being in leukemia patients. His research contributions have provided valuable insights into improving patient outcomes and promoting overall well-being. Welcome, Dr. AmirYousef.
Hello to you, Dr. Nigar, and to our audiences. And thank you so much to you and to your organization, MedSynapse, for giving me this opportunity to be here. I've heard about MedSynapse a lot, and so today I'm so grateful that I'm having this opportunity to join this interview. Thank you so much.
Thank you so much for taking the initiative to collaborate with us on this wonderful project.
It's my pleasure. Thank you.
Thank you. So today our discussion will revolve around an essential aspect of healthcare, medication safety in family medicine. Dr. Zahedi will share his knowledge and insights on reducing adverse drug effects and enhancing patient outcomes. We will delve into common challenges, strategies for promoting adherence, and effective communication to ensure the safe and optimal use of medications. So, without further delay, let's begin our discussion. But before we begin, I would like to ask Dr. Zahedi, considering your experience and expertise, what advice would you give to aspiring doctors who are passionate about pursuing a career in family medicine?
Sure, of course, that's a great question, actually. Based on my experience, I would have just some tips, actually, not advice, to our friends or to our freshly graduated doctors or people who are going to be doctors in future. So I would like to tell them that to just consider like 3 points which were like so helpful to me. So the first one I would recommend is to go through like all evidences and be evidence-based, because it's so important to be evidence-based and to be updated by according to new guidelines, because as further as we go, guidelines are being changed. So it's better to be up to date. Also, the second thing that I would just recommend is to learn a new language. So as many as language that you learn, it might help you to go through resources. It might help you to have like more detailed research. And the third one, which was so helpful to me, to be like so communicatable, actually. Like as much as communication, like as better as communication that you have, it might help you to like gather more information from your patient. So being talkative and making your patient to be in a friendly zone might help you to gather more information. So as much as information that you gather from your patient, exactly like your diagnosis will be like proper.
I definitely agree with you. Communication is I think one of the most powerful tools that doctors can have in order to build trust and a good bond so that they can communicate everything effectively.
Exactly. A patient who comes to my office, of course, he or she has some problem. That's why he or she came to my office. So a person who has some problem, of course, he or she is not that much talkative. So he or she being not talkative is a minus point actually for us, because we have to gather information, right? So we have to gather information about their medical history, about their allergies, about what has happened so far for their illness. So it's so important actually to be talkative. So when you are talkative, it makes them to talk that much to you.
Thank you so much for your very valuable points for our future medical aspirants who should focus on these points. It's
Thank you.
not only just about knowledge, but also having the ethical principles to be able to follow
Absolutely.
with patients. Now, let's dive into our topic. The
Sure.
first question, I'm curious to know what are some common side effects of medications that you commonly encounter in family medicine, and how do you manage them while ensuring patient safety and adherence to treatment at the same time?
So, well, basically, as a general practitioner, I have encountered like several common side effects while treating my patients. So, it is so crucial to be aware of these side effects and manage them effectively while we are ensuring patient safety and adherence to treatment. So, one of the most common side effects I have come across is medication related adverse effects. So different medications can cause range of side effects such as nausea, dizziness, fatigue, or gastrointestinal issues. So to manage these side effects, I take a proactive approach by discussing potential side effects. So, before starting any medication, basically what I do is to make my patients aware of any risks or side effects which might happen to them. So, this allows them to be informed and mentally prepared for it. So, I also, I monitor their progress closely during like our follow-up visits and encourage open communication. So as I mentioned, it is so important so that any emerging side effects can be addressed as soon as possible to me. So another common side effects which is also non-adherence to treatment plans. Patients may forget their medications. They may forget to take their medications, skip doses, or discontinue treatment. It might happen mostly in like elderly patients. So to address this, I employ several strategies. So firstly, I ensure that the treatment plan is feasible and tailored to their patient's lifestyle and preferences. So it's so important actually to know their lifestyle and to just adapt your treatment style according to their lifestyle. So what it does is this increase actually the likelihood of the adherence. So I also take time to educate patients about the importance of following the prescribed treatment. So additionally, I encourage also patients to ask questions and clarify any concerns they may have regarding their treatment. That's why in the beginning I mentioned that it's better to just make a friendly zone with them. So as a conclusion, I would like to say to manage side effects, I would like to prioritize open communications and also tailored treatment plans. So patients' educations are also so important. And another thing that we have to consider is to have a close monitoring with the patient to ensure the patient's safety. So these points are so important from my side.
Thank you so much, Dr. Amir, for your insightful response. It is essential to prioritize the patient's safety and ensure that they are well informed about the potential side effects and the importance of managing the dosages as well. Now,
Exactly.
let's move on to our next question. Can you give examples of dosage challenges you often face in work?
Yeah, certainly. Actually, in my work, I'm mostly faced with some cases such as like mostly pediatric dosage. So we know that pediatric dosage are like they're prescribing medications for children requires like careful consideration of their age, weight, and developmental stage. So we have to consider it. Or in some cases for geriatric patients, for elderly patients who may have age-related changes, like they will have a problem regarding like age-related changes in organ function and metabolism. Also, another point might be for patients who have renal and hepatic impairment. So, in such patients with kidney or liver problems, they may have difficulties metabolizing and eliminating medications. Or another example might be in patients who are like polypharmacy. So we know that for some patients, especially for older adults, they may be taking multiple medications. They take them like simultaneously. So it increases the risk of drug interactions and dosage challenges actually. So I guess we have to consider all these points about such patients.
Thank you, doctor, for your insightful answers. So, from my understanding, it's important to simplify the medication regimen to be easily understandable to the patients, especially the
Exactly.
elderly and the
Yeah,
child.
yeah, yeah, exactly. That's so true, Dr. Nagar.
Moving on to the next question. How do you make sure your patients take the right medication doses consistently? And what strategies or tools do you use to monitor and to encourage them to stick to their medication?
To ensure patients take the right medication doses consistently or not, I employ some strategies such as patient education, also clear instructions to them, and I try to speak by their language. I don't try to use make it complicated for them. So I try to use simplified regimens, and also medication reminders tools and apps are so important because nowadays like technology has been developed, so it's better to use some tools or apps, even charts or graphs, as a reminder for their medications, for their doses. So also another thing which might be helpful is regular follow-up. So we have to have like regular and encourage the patient to have a regular follow-up with us. And another point might be also patient engagement, and we have to also consider getting support from the caregivers. So in some cases, the patient himself or herself maybe might have, during due to some lifestyle problems or whatever, might have some problem. So it's better to get some support and to be in contact with the caregivers of the patients as well. So that's so important.
Well, um, as a doctor, I believe that we should pay attention to every aspect and to every details of the patient, especially the point that you mentioned about contacting the caregivers as well.
Exactly, because it's like people's lives, so we have to consider all aspects and we have to like take care of all details about them.
Now, moving on to the next question. How do you identify and distinguish between expected side effects and unexpected potential harmful effects of medications in your patients?
Firstly, the knowledge of medications are so important. So another thing that I might add to your first question that you just asked in the beginning of our interview will be, so as a recommendation, I would recommend like fresher doctors or people who are going to be doctors in future. I would recommend them to take care of the pharmacology knowledge. I would recommend them to be more familiar and to go deep through medications, because it is so important. So I stay updated with the known side effects of commonly prescribed medications. Because medications are our first tool as doctors. So I inform patients about the potential side effects and which are associated with their prescribed medications. So to inform them, of course, I need to have enough knowledge. And also I closely monitor patients' response to medications, and of course like collaboration with other specialties. So if there are concerns like any concerns regarding like potential harmful effects, I would just collaborate with specialists or consult other healthcare professionals to just gather their expertise and opinions, because even we as doctors are like, we are able to just make some faults, unfortunately, like we are humans. So that's why we have to just guarantee our patient, because as I mentioned, it's people's life. So there are the most important points that I just mentioned, and these are like, I think we have to things that we have to consider.
Now, speaking about collaboration with doctors, as you've mentioned, how do you communicate and collaborate effectively with other healthcare providers to enhance the medication safety for the patients?
So that's a good question, actually. Most importantly, like clear and timely documentations from our sides are so important. So I myself try to just maintain clear and comprehensive documentation of patients' medical records. There like it might include some medication lists or allergies or relevant like clinical informations. So if like patients comes to us first as family medicine doctor, so that's why it's my duty to just hand the clearest documentation to the next specialist. So this ensures that other healthcare providers have access to accurate and up-to-date information when making their treatment decisions. And also, timely informations are very important. Sharing is like time sharing the timely informations are very sensitive point. And about treatment process, we shouldn't neither be in rush, nor we shouldn't just being like late to hand the documents. So of course, lastly, being in multidisciplinary meetings are very important. I actively try to just participate in multidisciplinary team meetings. So it is like where healthcare providers from different disciplines come together and to discuss patient cares and review treatment plans. It is actually like excellent for us because it might help us as family medicine doctors to just go deep in details of the patient's history, the patient's like review and everything. Also, it might be helpful for us to just have up-to-date information about patient until the last stage of patient being cured completely. So I guess these are the points that we have to consider.
So, teamwork provides a safe approach to the management of medication.
Absolutely right.
Let's move on to the next question. What steps do you take to educate your patients about their medications, including the potential risks and adverse effects?
Well, the patients are our centered communication. They should be actually our centered communication. So it is very important that we make the patient himself or herself the center of our communication. That's why I mentioned that we have to make them like talk to us. I also try to use some visual aids, as I mentioned, such as medications charts or diagrams to help patients visualize their medications and of course, as I also mentioned earlier, to discuss like potential risk factors with the patients and also be in direct contact with their caregivers.
Now, let's move on to our next question. What proactive measures or strategies can healthcare professionals take to minimize the occurrence of adverse effects related to medications and enhance the safety in family medicine?
Well, as a medical doctor and also pharmacovigilance expert, true assessment is very important point. So we have to conduct a patient's medical history, including like allergies or comorbidities and so on. So it helps us to identify the potential risk factors and also to anticipate adverse effects of medications. And also, the other point we have to consider is to just have evidence based prescribing by following up to date guidelines. As I mentioned, it is very important because side effects of medications are being like under research every day. So we have to just be up to date and just go through the guidelines. And lastly, the patient specific considerations are very important. So we have to take into account the patient's individual factors, such as it might be genetic variations or lifestyle considerations when we are selecting the medications. There might be some patients even saying that, okay, doctor, my lifestyle is like I have to work during night, so I have to sleep during the day. So we have to just consider all these points, and considering them means like even prescribing medications and being in contact with them according to their lifestyle.
So, I understood that conducting thorough assessments, continuous learning of the lifestyles of the patient, and establishing a strong communications contribute to this culture of patient doctor relationship to how to say, to avoid the adverse effects in the future.
Absolutely right. Absolutely right.
Now, let's move on to our final question. The most wanted area about the antibacterial resistance. In your experience, how often do patients initiate discussions or express their concerns about antibacterial resistance, and based on their own internet research?
That's actually a great question. Because I myself have some problems regarding Google-based action. So I kind of have like some allergies when patients say that, I Googled it, and there might be some patients even saying, I Googled my symptoms and doctor, I have some kind of cancer. So patients like to actually go through Google, and my patients, especially like from non-European patients, like from non-European countries, uh, actually because maybe I don't know. Unfortunately, we used to know that for any symptom of grippe, for instance, the first Google-based evidence or our aunt or uncle-based evidence is going through antibiotics firstly. But nowadays we know that how important is side effects of being antibiotic resistant. What I do is actually listening to just my patients. I try to make them aware of all like these topics that being like antibiotic resistance is so important. Maybe during like that illness, they won't care. Like they would be like, okay, I'm gonna take antibiotics. If it works, like I'm gonna get well in like instead of 5 days, maybe I'll get very well in 3 days. But of course, being also evidence-based and showing them evidences to also educate them like further on the causes or consequences, and also preventions of antibacterial resistance are so important. So we have to make them aware of all these side effects and anything bad which might happen due to using Google-based antibiotics.
Nowadays, it has become very easily accessible to get antibiotics. Like,
Yeah,
no matter
unfortunately.
what happens, just patients go for antibiotics, unfortunately. Thank you so much, Dr. AmirYousef Zahedi, for sharing your valuable insights and expertise with us today.
Thank you so
Conversation.
much too. It was my pleasure to be interviewed by you, Dr. Nigar, and by MedSynapse team. So it was my pleasure. Thank you so much.
Thank you so much, Doctor. And before we wrap up, I would like to remind all of you about our MedSynapse platform, where you, as a professional doctor, can actively participate in discussions and connect with expert doctors. If you're looking for a community where you can engage in meaningful conversations about medicine and contribute to the advancement of healthcare, I highly recommend checking out our MedSynapse platform. Until next time, stay curious and keep exploring the vast world of medicine. Take care, and thank you for your listening. Goodbye.